Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello, good morning everyone. Good morning, moms. My name is Wulan Gunaristi. I'm here today to explain about postpartum care. This talk is divided into 5 main parts. First, definition of postpartum care. Second, why is the postpartum care important? Third, how many visits in the postpartum care? Fourth, who is going to handle the postpartum care? And the last is what are the treatment for doing postpartum care? Okay, my presentation will take approximately 15 minutes. Okay, are you ready, moms? Firstly, I'd like to look at definition of postpartum care. According to Praviharjo in 201, postpartum is the time needed by the mother to restore her womb to its original state from giving birth to a baby after the first 2 hours of labor lasting between 6 weeks or 42 days. Okay, let's now move on to the next slide. Secondly, I'll be talking about why is the postpartum care important. According to Padilla, in 2014, postpartum care is important because it prevents bleeding, provides physical comfort, nutrition, hydration, safety, and elimination. According to Marnie, in 2011, provide health education about self-help care, nutrition, family planning, method and need of breastfeeding, immunization, and daily baby care. Okay, let's now move on next slide. Thirdly, how many visits in doing postpartum care? If we look at this slide, the frequency of postpartum visit is that the first postpartum visit is carried out 6 hours to 3 days after delivery, and the second postpartum visit is 4 to 28 days after delivery, and the third postpartum visit is 29 to 42 days after delivery. Check blood pressure, vaginal bleeding, perineal condition, site of infection, uterine contraction, fundal pain, and temperature regularly. Okay, I now want go to next slide. My first point will be about who is going to handle the postpartum care. The postpartum care is handled by OBGYN or midwife. So far we have looked at this slide. Now I'd like the next slide. And then finally, I'll be talking at last slide. What are the treatment for doing postpartum care? Postpartum care to accelerate the healing period of wounds in the vagina, abdomen, and prevent complication after delivery. First, get enough rest. After giving birth, try to get plenty of rest. Childbirth is a painstaking process, so make sure you can refine to make up of your loose sleep. Okay, when you just have a baby, it's not easy to steal time to sleep. Babies still often wake up every 2 to 3 hours to feed. So, to catch a break, sleep while if your baby is sleeping. Okay, second point is don't hesitate to ask people close to you for help. Being a new mother is not easy. Also, don't hesitate to ask for help from those around you to help with the postnatal care process, including doing other things like cleaning the house, cooking, or solving for daily needs. Meanwhile, focus your energy on caring for the newborn. Okay, third is eat healthy food. Eating a healthy diet can help speed up the recovery process. Therefore, for the time being, avoid unhealthy foods such as fast food or packaged foods that contain a lot of sugar and salt. Eat healthier foods such as whole grains, vegetables, and fruit and protein. You also need encourage your fluid intake by drinking lots of water, especially if you are breastfeeding. Okay. Fourth point is start exercising. Of course, exercise that can be done by new mothers is not strenuous exercise, such as cardio exercise. If your doctor has allowed you to start physical activity, do leg exercise such as walking around the house. Looking at the start studying a scenery after just being indoors for a while can make you feel more refreshed and energized. Okay, fifth point is avoid sex for a while. After giving birth, you should avoid intercourse for a while to prevent infections. Generally, your healthcare provider will also advise that intercourse can be resumed after your perineal area and healing, or the abdominal scan from a cesarean delivery has healed. And when the postpartum bleeding has subsided. Okay, the last point is make an appointment with a gynecologist. Your healthcare provider will generally schedule a follow-up visit within 4 to 6 weeks of delivery. Some health care providers may advise you to visit earlier, such as 2 weeks after delivery. Okay, and the next is normal postpartum care. Uh, what are treatment for doing postpartum care? First, treatment for vaginal pain. During labor, the perineal lining, which is between the vagina and rectum, can widen and tear, causing vaginal pain. To relieve postpartum pain, you can take this step. First, compress the area with a cold compress. Second, don't sit on a hard chair. Always cover the seat with a pillow. Third, clean the vagina with warm water after urinating. And the last step is after defecating, press the wound area with a clean cloth and then clean the surrounding area with water and wipe with a tissue from front to back. Okay, a second point is treatment for bleeding. After delivery, it is normal for some bleeding to occur. Postpartum bleeding can occur for several weeks with the most volume and contraction in the first few days after delivery. Over time, the fluid that comes out of the vagina no longer looks like fluid, but rather resembles a vaginal discharge. Even so, if the blood that comes out very much and makes the pants you use full in just half an hour, you should immediately contact a doctor. Okay, the third is treatment for contraction. You can also still feel contraction a few days after delivery. The contraction that occur will feel like cramps during menstruation. This condition can also occur while breastfeeding. To overcome this, the doctor will usually give a pain relief. Uh, the the fourth point is treatment for urinary disorder. Vaginal delivery will also make the bladder delayed and cause temporary nerve and muscle damage. This condition makes it difficult to urinate. Even if you feel like you need to urinate, even when urinating, there will be little pain. Okay, to fix this, pour water on the genital area while bleeding on the toilet to help reduce pain. In condition, the labor process can also trigger your urine to then come out accidentally, even if small amount. Okay, the fifth point is care for breast. Swelling of the breast is a condition that often occurs in breastfeeding mothers. To reduce pain in the breast due to this swelling, breastfeeding or pumping breast milk is the most effective solution. You can also apply cold compresses to your breasts when you're not breastfeeding. If you're not breastfeeding, wear a tight-fitting bra and avoid touching your breast because touching the breast can stimulate it to produce more milk. Okay, sixth point is care for hair and skin. After delivery, your hair will fall out for up to 5 months. Stretch marks on the skin still will not disappear. immediately, but will fade from reddish to silvery white. Black patches on skin that appear during pregnancy also gradually fade. Okay, the last point in normal postpartum care is stabilized emotion. For mothers who experience the baby blues syndrome or postpartum depression, support from their husbands, friends, and family is very important. In addition, do not hesitate to consult a psychologist or psychiatrist if this condition doesn't subside. Okay, let's move on care after test heart delivery. First, prevention of blood clots. One of the biggest risks of having a test heart delivery is the, forfo- the formation of blood clots in the leg. To prevent this, the doctor can provide a special compression device that will keep blood flowing in the body smoothly. In addition, mother is also advised to start moving a lot. The second point is treatment for postpartum cramps. In the first 20 hours, 24 hours post-operatively, pain will generally appear to the cervical side. In addition to pain, cramping is in the stomach can also occur due to shifting of uterus after childbirth. To overcome this, doctors can prescribe pain relievers. The third point is prevention of infection in cervical wound. Another care after cesarean delivery is paying attention to cervical wound. After the delivery process is complete, there is one thing to look out for, namely sign of infection and in cervical wound. To prevent infection, you need to keep a cervical wound clean and watch out for signs of infection, such as fever, swelling, and pain. Okay. Uh, the next point is rest in the first week postpartum. The first week after cesarean section is the most ripe time for bleeding. To prevent this, you need to limit cycle activity to 6 to 8 weeks after giving birth. The last point is postpartum mental state. Quite from the Cleveland clinic, put in mother who gave birth vaginally or by cesarean, mental condition is very important to note. If there are words from relatives or friends that you feel are offensive, talk to your husband or parents to reduce the burden on your mind. Okay, I think it's enough, and I'd like to finish by embracing postpartum care needs to be carried out by postpartum mothers to maintain the health and safety of mothers and babies, either by consulting with OBGYN or midwife or by self-care. Thank you so much for your time and your attention. I hope we are always in good condition. Stay healthy. Stay healthy. Assalamualaikum warahmatullahi wabarakatuh.